Good evening and welcome to the COVID-19 pandemic updates. I'm Kayode Okikelu. But first, the highlights. Governor Sule, his deputy and other government functionaries take a second jab of the Oxford AstraZeneca vaccine as Nasarawa State flags off second dose exercise. The Governor of Kaduna State, Nasarawa El-Rufai, inaugurates COVID-19 Action Recovery and Economic Stimulus Program Committee, CARES, to boost economic recovery in the state. And pharmaceutical company Moderna soon to release data showing effectiveness of its COVID-19 vaccine in those between 12 and 17 years. The World Health Organization is encouraging nations to develop an international agreement, or simply put, a pandemic treaty that addresses shared vulnerabilities for future generations. On day 2 of the 74th World Health Assembly, the head of the organization, Dr. Tedros Ghebreyesus, sees this as a solution to one of the greatest drivers of COVID-19, which he says is lack of solidarity and sharing. He's also asking countries that have vaccinated their populations at most risk to share doses now, as well as the scaling up of manufacturing in all countries and getting funds for the COVAX facility. The 74th World Health Assembly focuses on essentially ending this pandemic and preventing the next. In the meantime, here's a look at some other COVID-19 trends.
The NCDC is advising that the validity period of the pre-boarding COVID-19 PCR test for all Nigeria-bound international travelers is now 72 hours or 3 days before departure, and results older than that will not be accepted. In the last NCDC case update, 42 new infections are reported from 7 states and the FCT, raising the country's total number of cases to 166,061. Lagos and Gombe states have 14 and 11 cases respectively. Ebonyi and Kano states have 5 cases each, while the FCT reported 4. Edo, Kaduna and Rivers states reported the least number of cases with 1 each. According to the agency, 0 cases were reported from Plateau, Nasarawa and Sokoto states. 16 persons have been discharged in the last 24 hours after recovering from the infection, increasing the number of recoveries to 156,492. There have been no deaths from COVID-19 complications in about 1 week, leaving the total number of casualties at 2,067. According to the last update by the National Primary Healthcare Development Agency, over 1.9 million Nigerians have received the first dose of the Oxford AstraZeneca vaccine so far.
The traditional and religious leaders would also...
An outbreak of cholera in Bauchi state has claimed 20 lives so far. The Commissioner for Health, Dr. Aliyu Maigoro, confirmed the outbreak during a media briefing and reports that Bauchi local government area accounts for the highest number of cases, with 147 confirmed cases out of the entire 322 cases in 9 local government areas. It says the outbreak may not be unconnected to the source of water supply in affected communities. Yet, water is essential to prevent infectious diseases.
Already, the rapid response team, they went into those communities. They treated the well. They gave health education to the community, as well as those that are infected, they were treated.
Globally, over 167 million cases and more than 3.4 million deaths have been reported from several countries.
The second dose of the COVID-19 vaccine has been launched in Nasarawa State by Governor Abdullahi Sule, who was also the first to take his second jab. The Deputy Governor, Dr. Emmanuel Akabi, and other government functionaries took their shots as well. The governor is asking the people of the state to avail themselves for the booster shots.
So I have just taken my second dosage, which I understand is the booster. I, again, want to encourage all those who have taken the first dosage that we understand we have not received any negative report from anybody, which means indeed this is safe. And I'm encouraging our dear people of Nasarawa State, to get ready and take the second dosage, just like the first dosage. This is just going to be the second. And it is not something new that has been brought to us. It's just 50% of what we were given during the first time. So the remaining 50% will be the second.
And after the economic impact of COVID-19 in Kaduna State, Governor Nasir El-Rufai has inaugurated a steering committee for Kaduna Cares, which is a COVID-19 action recovery and economic stimulus program to help businesses regain markets, revenue, and confidence. Well, speaking during the inauguration of at the Executive Council chambers of the State Government House, Governor El-Rufai says the Kaduna Cares program will help restore the livelihoods of the poor and vulnerable, maintaining food security and facilitating recovery of small and medium-scale enterprises. Beneficiaries of the program will be mined from the state's social register, farmers register, and other state databases through a transparent process in line with the key performance indicators. Over 33,000 households, farmers, and businesses are expected to benefit directly from the 3 phases of the program.
We warmly welcome the credit facility of $20 million that the World Bank is providing to support states in helping people and businesses get back in their strides. The Kaduna Cares program is designed to help restore the livelihoods of the poor and vulnerable, maintaining food security and facilitating recovery of small and medium-scale enterprises. Kaduna Cares is structured as a program for results to deliver results in 3 key areas. The result area 1 is increase social transfers, basic services and livelihood support to the poor and vulnerable households. Result area 2 covers increased food security and safe functioning of food supply chains. Result area 3, facilitating recovery of small and medium enterprises through grants.
Now, the Association of Medical Laboratory Scientists of Nigeria is confident that we can produce local vaccines for COVID-19 and other infectious diseases, but with a condition: if the federal government can urgently reactivate and strengthen medical laboratories across the country with qualified medical laboratory scientists. Well, how tall an order is this, and how much work do we have on our hands? Dr. Lulu Ojo is the Chairman, Research, Documentation and Industry Liaison Committee of the Pharmaceutical Society of Nigeria. He joins us virtually on the program this evening. It's great to have you on the program, Dr. Ojo. We always talk about capacity to produce vaccines, get drugs and all that. But if we could just put this in proper perspective, you're a player in that sector. Just how much capacity do we have really? I'm talking laboratories, manpower, raw materials, and the rest.
Yeah, thank you so much. Talking about capacity, particularly as human resource is concerned, I will say quite confidently that we have it. But talking about capacity, in terms of facility, the technology, the wherewithal to produce, they are not there at all. I think the point that needs to be made is this. Some of these things are not open to emergency, preparation or development that we are doing. I think it is a long-term thing. It has to be planned. It has to be worked out. Let us look, for instance, the vaccines that we are enjoying now. It just didn't come as a drop from heaven. Scientists have been involved in genome research, gene sequencing, and all this. So there are existing development that was tapped into when the need to bring up vaccine became an emergency. Vaccines are somewhere unjust. But in terms of human vaccines, they're not there. We used to have, or we have a facility.
Well, Dr. Joe, we're losing...
That has been moribund for years. You know, I can't remember whether... Can you hear me now?
Okay, yes, I think it's better now. Please go ahead.
Hello? Oh, yeah. What I'm saying is that in terms of human vaccines, we are not there. We are not producing any as of today.
Okay, you know, someone described COVID-19 as a teacher suddenly walking into a classroom and calling for a snap test. At that point, students have to rely on what they had read, essentially the capacity they had built before the teacher walked in. And I think you have touched on that, saying, I mean, it didn't just drop from heaven. So would you say it is realistic to talk about vaccine production as though we can begin now?
Well, the way technology has advanced is such that everything can be done now. Okay, look at what happened in India when there was problem with oxygen. You know, they received so much of help from countries, including already packaged oxygen production facility. So it is possible if we want to, if we are ready, if we have the finance to be able to do it. But what I want us to keep on hammering is to our policy makers, policy formulators and policy executors, is that some of these things are not open to emergency things like we are doing. Let us take this opportunity to take a firm decision that we need to develop our local capacity. We have the scientists, we have them all over the place. We should not allow them to be wasted. You see, ASU will be on strike for several months, including years, and yet these are people that will be doing research. The companies that are in Nigeria, they go through, I don't know what to use the word hell, but that is what comes to my mind now. Before they can even do ordinary importation and selling, talk less of having production here. Recombinant technology is not new. It's been there for years. How come we are lagging so much behind? It's a question that we need to ask. It's not that we want to produce now. Yes, we can produce. But hey, we need to have a system in place that we make sure that will get us ready to handle emergencies like this. And look at what is happening now. India is in trouble. And because of that, they said, hey, we have been sending vaccines to other countries, but we need it now in our country. Therefore, we cannot send to it. And that is why countries like Nigeria, we have to wait until we get from some donors or from this or that. So, why we can do it in government, and I want you to please note this, government, because it is about policy, it's about finance, it's about system, it's about development, it's about readiness. But if you ask me, do we have the human capacity? We have them. Virologists, pharmacists, people who can do the job.
Well, absolutely. You just hit the nail right there on the head. Policies, and you put this at the table of the government. But I would like to thank you so much, Dr. Oluojo, Chairman, Research, Documentation and Industry Liaison Committee of the Pharmaceutical Society of Nigeria. Thanks for speaking with us on the program this evening.
Thank you so much. Thank you.
We'll go on a break now, and when we return, we'll tell you about Lagos State and what it is doing, not just for COVID-19, but for other infectious diseases, plus people's health-seeking behavior in Nigeria. A family physician will be joining us from Abuja to discuss this and more in a moment. To join us again. Welcome back. The Lagos State government says the COVID-19 pandemic is not distracting it from other deadly diseases like HIV and AIDS. According to the Chief Executive Officer of the State AIDS Control Agency, Dr. Mansurat Adeleke, the state government has constantly rolled out antiretroviral drugs for those living with HIV and AIDS in Lagos to ensure that their immune system is strong and they're safe from the coronavirus. Dr. Adeleke was speaking at the sensitization meeting with religious leaders and others on HIV prevention and stigma reduction in Lagos State.
HIV, if you are on medication and you are virally suppressed, then you are as good as the next person, as in the entire citizenry. So which is the slogan I said, you is equals to you. So all of them, we pushed out drugs into community pharmacies. Like 185 of the community pharmacies were stocked up with the antiretroviral drugs. What else did we do? We ensured that we instituted the multi-month drug. So all our clients that are currently on medication, because according to the NICE study that we did, that we disseminated in 2019, the prevalence of HIV in Lagos State is about 1.4%. So we know that we have about 120,000 that are currently, that are positive. And we know that we've gone a lot, and we've done it that there are about 107,000 clients or more on medication. All of them did not stock out. We made sure that we pushed out their drugs, and even in the case where they couldn't come to the facilities, our partners with the consortium, I said, with the contingency plan, they were able to deliver home delivery of the drugs. So, because they were of optimal drug use and all of that, they were not more prone to COVID than the regular citizenry.
Well, almost 2 million people have come forward to receive the first dose of the AstraZeneca vaccine. In fact, 1.92 million precisely. In other words, Nigeria has now vaccinated close to 1% of its estimated 200 million population. At this rate, the target to vaccinate 70% by 2021 to 2022 is clearly a long shot. I mean, it took us 3 months to almost hit 1%. But then the Primary Healthcare Development Agency sees this journey so far as a success, maybe because it is better than what some had predicted would be a massive failure with the reports and the theories that were flying around at the outset. Well, does this say anything about the health-seeking behavior of Nigerians in the context of COVID-19? Well, let's speak with Dr. Safiya Ojo. She's a family physician who definitely knows better. She joins us from our Abuja studio. Well, Dr. Safiya, just how much has COVID-19 really changed the health-seeking behavior of Nigerians?
Thanks so much for having me. COVID-19, as we all know, is an ongoing pandemic that has resulted into a large death toll in several countries, including India. A lot of people, yes, when they present with COVID-19, we know we can have asymptomatic cases in which they don't come down with symptoms. And some we could have moderate to severe symptoms, which could require hospital care and adequate treatment. Some of the symptoms we know include cough, chest pain, difficulty in breathing, and loss of smell, which is known as anosmia. The health-seeking behavior of individuals differ in the country at large. One thing we should consider is there are factors that actually enables one to get adequate health care or not. Some of these factors include financial constraint. Some people want to go to the hospital when they are sick, but they don't have the money to go to the hospital because they will have to get a card, they will have to pay for some bills, pay for lab tests and all that. Some people don't go because of the COVID-19 pandemic, they may be diagnosed. They think they will be diagnosed of COVID-19 when they go to the hospital. So some of them just feel, let me go to the pharmacy or seek traditional healers while sick. At the end of the day, when they don't feel well, they now go to the hospital when the situation is worsened. So it depends. A lot of people should know that they should seek medical care when sick. With the era of COVID-19 now, a lot of patients have been lost to follow-up. So they don't seek a competent medical health care when sick. A lot of them just believe I can treat myself at home, I can just ask of some drugs from my friends and all that. So the health-seeking behavior is worsened by the pandemic, which also makes us not to be able to know the actual incidence of new cases, the new cases we are having. Because a lot of patients, we know they may be asymptomatic, which means they may not even have symptoms, but they can actually transmit to others, even without symptoms. So that shows that people should keep their distance, we should keep using our face masks and also hand washing. These things has to be continued. Because even talking about the vaccine, just less than 1% of the population has been vaccinated, which shows we still have a long way to go. So we can't even be talking of herd immunity. in which you have a large population vaccinated and there is a general immunity to the population. So now we can't even talk about that. Less than 1% vaccinated is just like a drop in the ocean. So I think people should go seek competent medical care. They should go to the hospital while sick, and they should make sure they are well diagnosed. They should carry out all the tests they need to carry, the essential tests, and the right diagnosis will be made and they'll be treated. You know, so a lot of things we need to do now is to make sure we continue, if you have relations that are sick, don't be afraid that when you go to the hospital, maybe you contract COVID-19. It's better to go wear your face masks, go to the hospital. A proper history will be taken, examination, and proper diagnosis. A lot of people have had some complications at home due to the fact that they don't go to the hospital. So their health-seeking behavior is not good. It's worsened by the COVID-19 pandemic.
I think it's vital, really, to stay on that point which you just made, that the pandemic may have just worsened people's health-seeking behavior. But I also feel it's important to define what the right health-seeking behavior is, because, I mean, for people, it's different. Some have, you know, a local, for lack of a better term, perspective to these things. They go herbal sometimes. Some go, you know, different routes. So is there a standard health-seeking behavior that everybody should follow, or people should just go about whichever works for you?
There should be a standard when talking about healthcare-seeking behavior, because most treatment made in the hospital is evidence-based over years. A patient is diagnosed and is well treated based on evidence. So I think people should learn that when they feel sick or they feel any dysfunction in the body, they should go to the hospital so that they can be properly tested, examined, and treated. That will go a long way in avoiding the unnecessary complications which may arise from lack of adequate health care. So they should ensure they get proper treatment. They shouldn't think, some people may think, oh, it's spiritual. And yes, we're not really on spiritual part of illness, but you should go, let's do the medical aspects, then you pray. I know culture too has a long way to, when we're talking about health-seeking behavior. Some people just believe when you have a particular illness, it's not normal, it cannot be cured in the hospital. I think people should go to the hospital and let them be examined, a proper history is taken, and the right diagnosis is made. This will prevent unnecessary death. So people should have a standard. A standard is that when you're sick, go to the hospital. Don't think of going herbal. At the end of the day, complications may arise from herbal medications like liver failure, because the doses are not, people just give any amount of dose, not minding that it can affect some of the organs in the body.
Well, Dr. Safia Ojo, you've been on the field for years, so you definitely have seen these things. But we'd like to thank you so much for those thoughts on the program this evening, and wish you the very best.
Thanks so much for having me.
Well, outside Nigeria, pharmaceutical company Moderna says its COVID-19 vaccine is highly effective in adolescents aged 12 to 17. Now, there have been no COVID-19 cases seen in a trial involving 3,732 young volunteers who received 2 doses of the vaccine, compared with 4 cases in the control group that had placebo injections. Moderna says it will soon submit data to regulators globally to seek approval for use in teens.
News about Moderna comes as London recently launched a domestic tourism campaign to kickstart the British capital's economy after the prolonged social contract restrictions against the COVID-19 pandemic. The $8.5 billion campaign, called Let's Do London, will bring together the city's world-leading hospitality, culture, nightlife and retail venues to tourists from across the country. Figures show overseas visits to the UK were down 73% in 2020 compared to 2019 due to the pandemic, and foreign visitors spent 78% less in 2020.
Well, don't forget to protect yourself. Remember, the virus is still out there, so continue to take responsibility. And of course, visit our website, that's channelstv.com, for more updates and a better understanding of the pandemic. We also have all the big stories for you, all at your fingertips. Well, that's the COVID-19 update for today. Thank you for watching. I'm Kayode Okikulu. Please stay safe.